TIAA is on a mission. Why? Because 54% of Black Americans don't have enough savings to retire. So in collaboration with big-name artists like Wyclef Jean, TIAA released Paper Right, new music inspiring a new financial future. With 100% of streaming sales going to a nonprofit that teaches students how to invest. Stream Paper Right now and help close the gap.
Hey guys, Happy New Year. Welcome to today's podcast. I've got a fantastic guest for you today, someone from the medical professional field. So for all the audience out there, Dr. Gary Simonds, he's a brain surgeon. He's an author, professor, public speaker from North Carolina. So we're calling to you live from Houston, Texas, and North Carolina. And today's talk is going to be all about inside the operating room, neurosurgery, medicine. He's got a lot of interesting thing about not only the scientific aspects of neuroscience, but also the paranormal and spirituality. I love this topic, and it's going to be a great discussion. So, Gary, welcome.
Well, thanks so much for having me, and it's a pleasure and an honor.
And I love having physicians on my show, when they can, because their time is really limited. So kind of talk about your path to neurosurgery, what inspired you to choose that, and what you're doing now.
Well, thanks. It's a fairly open topic there. I will start by saying I have more time than I used to because I did hang up the scalpel a few years ago. I actually, ironically, had my own neurological illness really many years ago and recovered pretty well, but was getting a fair amount of echoes late in my career there, some double vision, some trouble with clumsiness in my hands, particularly when I was really fatigued. And I thought that is probably not the best conditions to be doing my surgery with. So now I am predominantly writing, but I'm also teaching undergrads and med students at Virginia Tech, doing a lot of neuroscience teaching with them. But yeah, I went into neurosurgery, I guess, out of slightly different background, where I was really considering the ministry. And I was kind of a biochemistry and religion major in college, and somehow I swung to the medical side and went from there. And then in med school, like a lot of us, I'm sure, went through multiple iterations of what I was going to be. But I love telling the story, particularly to the med students and pre-meds, that I was going to be a cardiothoracic doc in the end. I mean, I had my residency lined up and all that. And in my last rotation in medical school, I saw my first brain operation and I went, oh my God, I have got to do that. So I'm there switching horses in midstream, literally, running about, trying to find a residency, and had no idea what I was getting myself into, and definitely got myself into a lot. And I always tell the students, I still believe very much in following your heart when choosing a specialty, but probably do a little more research than I did. And so, then I was very busy neurosurgeon, at first in the Army and then at major medical centers and trauma centers, and ran the neurosurgery program and residency program at Virginia Tech Carilion in Virginia for 16 years or so. And then, as I said, hung up the scalpel a few years ago now.
Yeah, it's quite interesting. And like I said, we have med students, we got residents, we got, practicing attendings, listening on. And so kind of shares just some pivotal moments that shaped your journey, your view of medicine, just healthcare is changing, and so I'm just curious to see what you're seeing from your side of things.
Yeah, another huge topic. I was lucky. I kind of came in the golden age, I think, of operative neurosurgery. Kind of all the stars aligned where we were still doing big brain operations, but we had a lot of technological support and anesthesia support and stuff like that. And I was brought up, surrounded by great people. I trained at Walter Reed. I was in the Army at the time, and I trained at Walter Reed and was surrounded by just great fellow residents and attendings. I was an attending there as well. So I always had a very rosy-eyed picture of healthcare and healthcare delivery because I think there, particularly in the military, I mean, we were paid not too much, but enough, and we never worried about whether our patients could pay or not. And it was basically some form of socialized medicine, I guess, and we just did our job and did it as best we could. And I went out into the real world and still went into nonprofits, Geisinger, and then this Carillion healthcare system in Virginia, both of which were in the clinic model. And again, kind of salaried, socialized style medicine, taking all comers, big trauma centers. And so I always felt like I was part of the good guys, but I started seeing a lot of profiteering, and there's certainly a lot of profiteering even, amongst neurosurgeons, particularly in spine surgery, where you really start questioning the motivations behind some of the surgeries. So I guess, I eventually got a slightly more jaded picture, but I always saw us as the good guys and we were doing great stuff. And now neurosurgery is getting more and more minimally invasive and more is being done through catheters and stuff like that. So these big brain operations, which of course were more taxing on the patients, but they were more interesting and more fun from my side of the equation.
Yeah, it's quite interesting because you have to see these to actually, actually experience it. And how do you, especially in such a high stake, intricate procedure, how do you prepare mentally and emotionally?
Yeah, it's an experience, and I think everybody's doing it differently potentially. One of the first things, though, is you've got to kind of clear your head one way or the other.
Mhm.
We even experimented with some mindfulness exercises and stuff for a while there, just to see if it had any impact. And it did seem to have some positive impact. I was never very good at that stuff myself. But, in that world, in a place like the places I worked, there was stuff going on nonstop. The helicopters were coming in, terribly injured people all about. Our outcomes, neurosurgical outcomes, aren't the best on earth. So, you may leave an ICU patient who's doing very badly and you're feeling at least partially responsible, and you got to go down and then, leap into another operation. Sometimes I would do 3, 4, 5 operations in a day. And sometimes you're up all night as well doing a bunch of emergency operations. So anyway, I think one of the key things is you got to leave all that other stuff at the door and really zero in on the patient at hand. And I guess it was easier somewhat in our sphere, as soon as everything's at least set up, we're either under loops or we're under a microscope. So your world really hones down to this very small space. And there's a lot of living and dying going on in that little small space. So it is kind of easy to forget everything for a little while there. It was always a refuge because the minute you would step out, the pager or the phone would be going off. 5 people would be grabbing at you and saying, "We got this emergency and this problem and that problem." And in the OR, at least you could just focus in on one problem at a time.
Yeah, it's it's just kind of like zenning and honing down, just saving the patient's life and all the other stuff like notes and orders and all that. That's kind of been what medicine healthcare has become. And then kind of talk about loss and mistakes, because this is a field where everything's so high, and deal with the loss and complications. How do you cope with these situations, and advice would you give to people going through such experiences, in training, etc.?
Yeah, it's for I don't know, the past 15 years or so, I've been working a lot in the realm of burnout and trying to build resilience and wellness in healthcare providers. And I have 3 books on it, and I actually have a novel that very much focuses in on some of the concepts that you're just alluding to. But it's rough. At least neurosurgery is a rough and tumble field with a lot of bad outcomes. And, we have to admit to ourselves that we contribute to those bad outcomes sometimes. We're all fallible. We all can make mistakes, and it can be the simplest of errors, but you are going to ride that out for days and days if you feel like you in any way contributed to the patients. And even when it's obvious you didn't contribute to a bad outcome, you still take kind of an internal responsibility about it. So, when we were studying burnout within our own group and other neurosurgeons, what rose to the top, and we gave them lists of like 70 or 80 typical stressors in the job, and what always raised to the top was bad outcomes and errors. And so I think one of the first things that we have to do is just acknowledge that we take these hits, that we are human beings and we can't just drive through them. And that's kind of what we tend to do, is just lower our heads and drive, but we're taking hits along the way. And I think it's good every so often to acknowledge it and say, look, this is damaging me to one degree or another, and I have to find ways to repair. So some of which, and the repair is going to be different from person to person. What works particularly well for one person may not work for another, but certainly, breaks in the action, even frontline troops get breaks in the action. And we in medicine have a tendency to just go, 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 right? Nonstop, take more call, do more, clinics, all that sort of stuff. So, getting a break in the action periodically, hopefully even daily, but also, minor breaks in the week, big breaks in the months, all that sort of thing, I think is really important. I think it's also really helpful to have a supportive group that you're working with or colleagues that you're working with, because nobody understands the situation better than fellow colleagues. And to be able periodically to be able to debrief and talk with a colleague and just say, hey, I am feeling pretty rough after what's happened this week. And you don't necessarily need to relive every detail of a case that's gone bad, but to be able to say, God, this is really keeping me up at night. And it's amazing how powerful it is to have a partner, and particularly people you respect, say, hey, I've been there. I'm sorry, or to even offer it up front without even being solicited. Somebody says, hey, I heard, something went bad in the OR. That sucks. And just to hear somebody else say that sucks is, really goes a long way. Yeah. So there are many different ways, but I think start by just acknowledging that you can't just sail through it and think that everything's going to be rosy.
Yeah. Kind of reminds me of just looking at the NFL quarterback. He takes hits, and just like one of those hits could be career ending, and what techniques do you do to heal emotionally with all that emotional trauma, that guilt, that sadness, that loss, that grief? Is it just I know you talked about talking with colleagues. Any other one or two tips you can share?
Yeah, certainly that one piece of advice we might call debriefing our stressors, and that is to face the stressors and be able to discuss them openly. But we're always more concerned with our responses to the stressors, not the actual details of the stressors, but how are we responding, and is there a way we can respond more positively? So if we're going home and kicking the dog and screaming at everybody, is there a different way we could do that? Would it help to meditate? Would it help to go a few rounds with a punching bag? Would it be good to go to a gym? Whatever. Can we respond to our stressors a different way? But another thing that we always believe in complementing, even more than the debriefing of stressors, would be what we call collecting uplifts. And in the field of medicine, I think we train ourselves to look for bad things. I mean, we spend so much of our time always looking for when the boot's going to drop. So even when a case goes well, we don't all run around and high five. We're like, okay, what the hell can go wrong now? What is going to bite us in the butt? And we should be doing that. I mean, that's our job. We should anticipate what could go wrong. But what that does is it completely channels our brain to the negative side of our lives. And I think what is a really good exercise, for example, is what we would have people do is make themselves for 2-3 weeks at a time, make themselves notice a few things that happen good during the day and write them down or put them in your phone, but make yourself do it. So that, I've got to count 5 things today that went nicely. A nurse thanked me, a patient smiled, a patient's family hugged me, somebody we've been working on for 3 weeks actually got out of the hospital. These things are happening. So notice a few, make yourself notice a few, write them down. And what's kind of neat is you do rechannel your brain, you do rechannel your mind. And after a few weeks, what happens is you start noticing them a priori. You don't have to force yourself. They just start popping up into your consciousness, and you begin to realize that it's not all doom and gloom, that you actually are making an impact, that people are thankful, that people are getting better. And I think that's a really good counterweight.
Yeah. Yeah, I love that. And then kind of talk about because you also integrate paranormal, and which is interesting, and also spirituality with neuroscience. Kind of talk about how you find this intersection fascinating and how you find the balance between science and spirituality impacts healthcare and wellness.
Yeah, I probably won't hit the paranormal quite yet in that's kind of another channel that was really a function of the novel I wrote. But the spirituality side of it, religion and spirituality, I guess it's always been kind of an interest for me. And what's really kind of interested me along the way is how both sides kind of denigrate each other and shut each other down and assume that the other must be completely full of it and don't give each other credence. And we're particularly, I think we in medicine and certainly in neuroscience, we're particularly guilty of this. I think we have tremendous hubris in thinking that we've got the answer for everything. I mean, it's all figured out. If it's not figured out, we will figure it out. And there's no room for anything that is beyond our senses, or at least our technological sensors or whatever. We're so dismissive. But I think, one of the things that you learn in neuroscience is what a limited piece of machinery our brains are. I mean, our brains are miraculous and they do amazing things and all that. I know that. But they also are very limited. They screen out much of our environment. They present to us, basically our world is presented to us kind of as stories in which we can function better. But it's not necessarily a one-to-one representation of reality. So I come out of looking at all this and saying, well, how do we expect these brains to explain everything? And even if they could explain everything, how do we expect these brains to understand everything? So I just give tremendous leeway to the sense of spirituality or religion for anybody and everybody. And we certainly know in the resilience world, people with a sense of spirituality or a sense of religion tend to kind of automatically have a higher level of resilience with them. So I think we do everybody a disservice in medicine and in science if we just start saying, oh no, religion, spirituality, it's a bunch of bunk. You're just fooling yourself. We're shutting down a whole route of resilience, as well as I think probably fooling ourselves.
Yeah. Yeah. And Leslie, kind of conclude, your visions of healthcare's future. It's actually, going undergoing tremendous change. And, what do you see healthcare headed next 20 years, and what trends, innovation you believe will significantly impact the way we approach healthcare, medical education, training, and how can people follow you and find out more about you?
Well, thanks. I do have my own website, and it's very easy to contact me through that. It has all my books and all that sort of stuff. It's just my name, Gary, Garyr, and Simonds, Simonds. So Gary R. Simonds .com. So that one's pretty easy. I look at the future of healthcare, and I have big questions. I don't know about you, Chris, but I'm looking at AI, frankly, and I'm wondering what the role of at least primary care is going to be, and eventually, as the robotics get better and better, what the proceduralists will be doing. But I sometimes think that we may be quickly entering into a world where you say, "Hey, Alexa, I'm not feeling so well today." And Alexa goes through a bunch of symptoms and has a database of billions and already knows your history because, all your medical history is in it and all that. You probably have a smartwatch, so it knows all your vitals, all that sort of thing. Knows your buying habits, so it probably knows your habits and stuff like that. And maybe Alexa will go through the questions and even say, "Hey, put your finger in a sensor." And I mean, we're getting to a point where we're going to be able to do blood chemistries really just through our own sweat. So I'm wondering if then Alexa says, "Hey, you've got this here, we'll print up some pharmaceuticals for you," and you never see a physician. I don't know. What do you think?
Well, I mean, definitely this whole because you've got just basically cost cutting. A lot of doctors are getting phased out. You have private equity, but definitely this area where especially artificial intelligence is coming in, and you start to see companies such as Amazon, like there's Amazon Health now, and Apple's getting into healthcare. Once these tech companies get a strong hold in healthcare, then it's off to the races. I mean, they're just it's gonna be like Netflix, taking out Blockbuster. Yeah, you have Mark Cuban, especially the pharmacy just down the street, the CVS and Walgreens shut down because the pharmacist just walked out just because of unsafe conditions. So you're gonna see a lot, like I said, huge things. Again, there's going to be bureaucracy, there's going to be regulation, all of this, the people in power are going to try to keep everything the same. So, but it's going to be really interesting. I encourage my kids and my offspring to do other things besides medicine, which is kind of, it's a shame, but if healthcare isn't keeping up, then, but how can people contact you and follow you?
Again, probably the easiest way is just to go to my website. There's all sorts of contact information. It has all my social media, although I'm afraid I've gotten a little mired down in some of the social media on current politics, but I try to keep it clean on my website.
Yeah. Yeah, and for all the audience out there, let's thank Gary for coming on. And it was really great discussion with a fellow physician colleague. And be sure to check out all his resources. And with that, thanks so much for coming onto the podcast.
Chris, it's absolutely my delight.
Yeah, that was good. I really enjoyed that. That was a good.
Yeah, me too.
Yeah, so I'll leave you a 5-star review, and I'll follow you on all of your social media channels, and your episode will probably release next week. And I think a lot of people will enjoy listening to you have a very nice conversational style.
Oh, well, thanks. Thank you too. I'm not kidding though. I write some blogs for Psychology Today, and I'm just working on this one right now about AI and medicine because, what our fellow physicians do is they start saying, "Oh, the human touch, we got to have the human touch." And I'm like, boy, we dropped the human touch in an awful lot of other spheres. And I think we also anthropomorphize, like I said, Alexa, if you ever talk to Alexa, I'm polite to Alexa, could you please play this song for me or something like that. And then, this printing of pharmaceuticals is coming too. That technology is there.
Yeah.
And I could see it happening in your local corner store,
Yeah. Yeah, I think pharmacy will be the first, and it'll happen in the next few years, and then slowly it's going to be like primary care, and then finally it's going to be the proceduralist. But it's going to be
Yeah.
really interesting. Yeah, but yeah, thanks so much for connecting, and I'd love to have you in my network.
All right. Well, let's do it. Stay in touch.
Excellent. Well, Happy New Year.
You too, Chris.
Yeah.
Take care.
Uh-huh. Bye.